top Senate Republicans are trying to move on from the partisan drive to replace Obamacare despite urging from President Donald Trump to keep seeking a broad alternative to President Barack Obama's signature domestic achievement. Senate Finance Committee Chairman Orrin Hatch said Tuesday he sees little chance of further action on health care anytime soon. Work to address the Affordable Care Act's flaws will need to be bipartisan after last week's strive for a gop-only replacement collapsed. He said, "We've got to let it simmer for a while until we get both sides into a position where they see we've got to do something here," said Hatch. A Utah Republican, Senator John Thune of South Dakota, the number 3 Republican leader, said, "We've had our vote and we are moving on to tax reform." Senate Majority Leader Mitch McConnell of Kentucky told reporters Tuesday that while the GOP didn't have the votes for a health plan last week, he still sees an opportunity later to pass a measure under a fast-track procedure. Republicans are continuing to seek analyses on several proposals from the non-partisan Congressional Budget Office, he said. For now, the Senate is working to confirm Federal Bureau of Investigation nominee Christopher Wray and pass bills on veterans' benefits and the Food and Drug Administration before the August recess. The White House continues to seek action on a Republican-only health care measure, giving particular focus to a proposal by Senators Lindsey Graham of South Carolina and Bill Cassidy of Louisiana. The plan would send federal health care funds to the states in block grants, while keeping in place Obamacare's mandates that all Americans have insurance and most employers provide it. Quick take: axing the individual mandate. Trump met with Graham to discuss the idea just hours after GOP Senator John McCain of Arizona cast the decisive vote early Friday in the 49-51 rejection of a bare-bones repeal of Obamacare. Cassidy met at the White House Monday with Health and Human Services Secretary Tom Price and 4 Republican governors, including Arizona's Doug Ducey and Wisconsin's Scott Walker. "We need governors on the front end, not on the receiving end," Cassidy told reporters hours after his meeting. Bipartisan talks are expected on stabilizing Obamacare's insurance markets up front before Congress considers any longer-term changes. "I'm going to have more to say about that at the hearing this afternoon," said Senate Health Chairman Lamar Alexander of Tennessee. The committee's top Democrat, Patty Murray of Washington, also said she and Alexander plan an announcement on Obamacare talks Tuesday. Alexander said he wants Trump, in the meantime, to continue making federal cost-sharing subsidies to help low-income Americans buy coverage. The president has repeatedly threatened to halt such payments. Magic pills. Innate Minority Whip Richard Durbin of Illinois said Democrats also want to work after the August recess on a short-term measure to stabilize the insurance exchanges and continue cost-sharing subsidies. After that, something longer-term would be needed, but he dismissed the idea that the Graham-Cassidy proposal is an easy answer to Obamacare's challenges. "I want to slow down this magic pill theory, that there is just one idea out there that is going to solve it all," Durbin said. "I don't believe that. I want everybody to come up with their ideas. I think that's how you get something constructive. But it isn't just one thing. It isn't just say, let's send it all back to the states." Second-ranking Senate Republican John Cornyn of Texas told reporters Monday that the GOP probably lacks the votes to bring anything to the